So I'm a board certified child, adolescent, and adult psychiatrist. And here we're going to be covering the difference between schizophrenia and schizoaffective disorder. This is a question I got in our PMHNP coaching community. And so I wanted to make a full video explaining the difference and how to tell them apart. So let's get into that. So with schizophrenia, this is what I'll start with. There is a set list of diagnostic criteria where the patient must meet these symptoms. They must have two out of these five. So, delusions, hallucinations, and one of those symptoms has to be one of these, the delusions or the hallucinations. These are what we call the positive symptoms. Disorganized speech. So, right, speech, bad. Disorganized behavior and negative symptoms. Basically, symptoms that look like depression, but it's like withdrawal and things, social withdrawal. So we must have two out of these five symptoms. But now with schizoaffective disorder, so with affective, so this is phrenia, but now with the affective component, what this adds is plus depression symptoms or bipolar symptoms. So that's essentially the difference between schizophrenia and schizoaffective. Schizophrenia, you have all this. Schizoaffective adds in either major depressive disorder or a bipolar component to it. The best way I've found to visualize this is if we look at a timeline. So this all will be schizophrenia symptoms. So, like here and here, etc. But along the time horizon, you will sometimes have periods of here. You might go like this. They might go like this, and then you might go like this. What's happening here is that this is the affective component. So you see here. So this is the bipolar, the manic, and then this is the depressed. But all during this time, there is still psychotic symptoms happening. So you see in this like baseline here, there's still psychotic symptoms. So there might be bipolar, and then there's still psychotic, and then depressed, but there's psychosis still happening, and there's psychotic episodes in between the mood episodes. And so when you see this kind of pattern, that's how you know that you're dealing with a schizoaffective disorder as compared to just a schizophrenia. So that is the difference. So now if we're trying to treat it, okay, what do we do to treat this? The mainstay treatment of schizophrenia is antipsychotics. No, it's not a shocker, right? We all knew that. But then when you add in the affective, this is where you can add mood stabilizers or SSRIs, because you can add them to stabilize either some of the manic periods or some of the depressive periods. And then the antipsychotic will help with making sure like that there's not going to precipitate a manic episode, for example, if you get on the SSRI. So the antipsychotics are the mainstay, and then with the affective disorder, you can add these. You can also utilize mood-based APs, antipsychotics. So what do I mean by this? So some antipsychotics like risperidone, Haldol, those are more just like pure D2 blockade, dopamine psychosis blockade. So I'll say no risperidone, Haldol. So, but check olanzapine, Seroquel, Tuda. So these have more serotonergic activity too. And so Abilify is another one here. In addition to the D2 or the D3, the dopaminergic activity. So with this, using the mood-based antipsychotics, you can target some of the mood-based stuff here too. So that's what I like to go towards if there's an affective component. If it's just a pure schizophrenia component, then I will just utilize the, you can utilize the mood-based ones as well too. but then you're not wrong if you just utilize like risperidone or Haldol. So that's the way that I like to approach it. Of course, if you really get into the nuance of it, then you can use risperidone and Haldol in a schizoaffective disorder. Like let's say you're trying to avoid weight gain or something. You can use these, and then you might need to use mood stabilizers or SSRIs as well. So that's why it varies. It depends on the person to person. But this, in a nutshell, is the difference between schizophrenia and schizoaffective disorder. So I hope that's helpful. And if you want to learn more real-world psychiatry stuff like this, best place to do that is in our PMHNP coaching program, where we've had over 230 students go through so far and really get a lot of value out of it for PMHNPs and FNPs to really boost your real-world psychiatric confidence and get over imposter syndrome by learning from a board-certified child, adolescent, and adult psychiatrist. So definitely recommend checking that out. And otherwise, I'll see you in the next video.